Your dog can't tell you when something is wrong, but their body can. Some signs may seem minor, but they could mean serious health problems. Ignoring them could put your dog at risk. In this video, you'll learn 11 warning signs that mean you should call your vet immediately. If your dog shows any of these symptoms, don't wait. Act fast to keep them safe. Subscribe to Positive TV and let's dive in. Sign number 1. Sudden loss of appetite. Dogs have a strong drive to eat. Most dogs get excited at mealtime, eagerly waiting for food. If your dog suddenly stops eating or shows disinterest in meals, this is a warning sign. A skipped meal may not be serious, but refusal to eat for an entire day or more could indicate an underlying problem. Loss of appetite can be caused by pain, nausea, dental issues, infections, or more serious conditions like kidney or liver disease. Stress and environmental changes may also affect eating habits, but a prolonged refusal to eat points to a medical issue. Keep an eye on any other symptoms, such as lethargy or weight loss, that accompany the appetite change. If your dog avoids food for more than 24 hours, contact your veterinarian. Puppies, senior dogs, and small breeds are especially vulnerable to rapid weight loss and weakness when they don't eat. Early intervention can prevent more serious health issues and help identify the cause of the appetite loss. Sign number 2. Vomiting or diarrhea. A dog's digestive system is sensitive. Occasional vomiting or diarrhea can happen from eating something unusual, minor stomach upset, or stress. However, frequent vomiting or diarrhea is a red flag. If these symptoms persist, they can lead to dehydration, electrolyte imbalances, and further complications. If vomiting or diarrhea occurs multiple times in a day, lasts more than 24 hours, or includes blood, seek veterinary help immediately. Bloody vomit or stool may indicate internal bleeding, infections, or toxic ingestion. A veterinarian can determine if the cause is a viral infection, food poisoning, parasites, or an underlying disease. To help your dog in the short term, ensure they have access to fresh water to prevent dehydration. Avoid feeding them for a few hours to let their stomach settle, then reintroduce bland foods like boiled chicken and rice. However, if symptoms persist, veterinary care is crucial to avoid severe health risks. Sign number 3. Difficulty breathing. Dogs pant to cool down, but breathing should still appear normal and steady. If your dog is gasping, wheezing, or struggling to breathe, this signals a serious problem. Labored breathing, excessive panting at rest, or blue or pale gums indicate oxygen deprivation and require immediate attention. Respiratory distress can stem from heart disease, lung infections, allergic reactions, or airway obstructions. Some breeds, like bulldogs and pugs, are more prone to breathing difficulties due to their facial structure. However, sudden breathing problems in any dog should never be ignored. If your dog is struggling to breathe, keep them calm and avoid unnecessary movement. Stress can make breathing worse. Call your veterinarian or an emergency pet clinic right away. A quick response can prevent complications and improve your dog's chances of recovery. Sign number 4. Seizures or convulsions. Seizures in dogs can appear as sudden, uncontrollable shaking, muscle twitching, or even temporary loss of consciousness. Some dogs may also drool excessively, paddle their legs, or lose control of their bladder or bowels. A seizure may last only a few seconds, but it is still a serious medical event that requires attention. Several conditions can trigger seizures. Epilepsy is a common cause, especially in certain breeds, but seizures can also result from poisoning, low blood sugar, head trauma, or neurological disorders. In some cases, underlying conditions like liver or kidney disease can lead to abnormal brain activity, causing convulsions. Identifying the root cause is crucial for proper treatment. Even a single seizure warrants a visit to the vet. If your dog experiences multiple seizures within a short period or has a prolonged seizure lasting more than a couple of minutes, seek emergency care immediately. While waiting for help, keep your dog safe by moving objects away from them and ensuring they don't fall or injure themselves. Do not attempt to hold their tongue or place anything in their mouth, as this can cause harm. Sign number 5. Pale gums or blue-tinged gums. A dog's gums provide important clues about their health. Healthy gums should be moist and pink. If your dog's gums suddenly turn pale, white, or grayish, it may indicate shock, anemia, or internal bleeding. Blood loss, either external or internal, can quickly become life-threatening and requires urgent veterinary care. Blue-tinged gums, also called cyanosis, are even more concerning. This suggests a lack of oxygen in the bloodstream, which could result from respiratory distress, heart disease, or airway obstructions. If your dog is struggling to breathe alongside gum discoloration, this is a medical emergency that needs immediate attention. Regularly checking your dog's gums can help detect health issues early. If you notice abnormal gum color, do not wait for other symptoms to appear. Seek veterinary care immediately to determine the cause and provide necessary treatment. Oxygen deprivation or blood loss can rapidly become fatal if left untreated. Sign number 6. Lethargy or depression. Dogs are naturally energetic and curious. If your dog suddenly becomes tired, uninterested in activities, or weak, this signals a problem. Occasional tiredness after intense play is normal, but prolonged lethargy or sudden loss of enthusiasm is concerning. Lethargy can result from infections, pain, metabolic disorders, or organ dysfunction. Conditions such as fever, dehydration, or anemia can drain a dog's energy, making them appear sluggish. In some cases, toxins, medications, or underlying diseases like diabetes or heart conditions may also contribute to weakness and fatigue. If your dog remains unusually inactive for more than a day or shows other concerning symptoms like loss of appetite, vomiting, or difficulty moving, a vet visit is necessary. Sudden drops in energy often indicate an internal issue that needs prompt diagnosis and treatment. Recognizing changes in behavior early can help prevent serious health complications. Sign number 7. Whining or whimpering. Dogs use vocalizations to communicate their needs, discomfort, or distress. Occasional whining may be normal, but persistent whimpering, yelping, or crying signals a deeper issue. If your dog suddenly starts whining more than usual, especially without an obvious reason, they may be in pain or feeling unwell. Pain is a common cause of excessive vocalization. Injuries, arthritis, dental problems, or internal issues like gastrointestinal distress can make a dog uncomfortable enough to cry out. Anxiety, fear, or stress can also trigger whining, but distinguishing between emotional distress and physical pain is important. If your dog seems restless, avoids movement, or reacts when touched, pain is likely the cause. If your dog continues to whine for an extended period, a vet visit is necessary. Do not ignore this behavior, as it can indicate a serious underlying condition. Monitoring other signs like limping, loss of appetite, or unusual posture can help your vet diagnose the issue more quickly. Early intervention can prevent further discomfort and complications. Sign number 8. Changes in urination or defecation. A dog's bathroom habits can reveal a lot about their health. Frequent urination, difficulty urinating, or sudden accidents indoors may indicate a urinary tract infection, kidney disease, or bladder stones. Straining or producing small amounts of urine can also signal an obstruction, which is an emergency. Changes in defecation, such as constipation, diarrhea, or unusual stool consistency, can also point to digestive issues. Loose stool may result from dietary changes, minor stomach upset, or infections, but persistent diarrhea can cause dehydration and needs medical attention. Constipation, especially if paired with straining, lethargy, or bloating, could indicate a blockage or other serious condition. If your dog shows any signs of discomfort while relieving themselves, do not wait to seek veterinary help. Track any changes in frequency, color, or consistency of urine and stool, as these details can help your vet determine the cause. Early treatment can prevent further complications and discomfort for your dog. Sign number 9. Redness or discharge in eyes or nose. A dog's eyes and nose should be clear and free of excessive discharge. If you notice redness, swelling, or unusual fluid coming from these areas, it may indicate an infection, allergies, or respiratory illness. Mild irritation may resolve on its own, but persistent symptoms require veterinary attention. Eye infections, injuries, or conditions like conjunctivitis can cause redness, squinting, or excessive tearing. If the discharge is thick, yellow, or green, an infection is likely present. Similarly, a constantly runny nose or nasal congestion can suggest an upper respiratory infection, sinus issues, or even fungal infections. If your dog has red eyes, a runny nose, or difficulty breathing through their nostrils, seek medical advice promptly. Delayed treatment can lead to worsening infections or discomfort. Keeping an eye on these symptoms ensures early intervention and a quicker recovery for your dog. Sign number 10. Changes in gait or mobility. A healthy dog moves with ease and confidence. If your dog suddenly starts limping, stumbling, or struggling to walk, this is a sign of discomfort or an underlying health issue. While minor injuries from rough play or exercise can cause temporary soreness, persistent mobility issues should never be ignored. Joint pain, arthritis, muscle injuries, and nerve problems are common causes of mobility changes. Older dogs are especially prone to arthritis, which can make movement stiff and painful. However, sudden weakness in the legs or difficulty standing may indicate a more serious condition, such as a spinal issue or neurological disorder. Some diseases, like Lyme disease, can also affect a dog's ability to walk normally. If your dog shows signs of pain when walking, avoids putting weight on a leg, or has trouble standing up, schedule a vet visit. In cases of sudden or severe weakness, seek emergency care. Early diagnosis and treatment can improve mobility, relieve discomfort, and prevent further complications. Sign number 11. Unexplained weight loss. A dog's weight should remain stable unless there is a change in diet or activity level. If your dog is losing weight rapidly without a clear reason, this is a serious concern. Weight loss can be a sign of an underlying medical issue, especially if it happens suddenly or continues over time. Common causes of unexplained weight loss include diabetes, cancer, digestive disorders, and metabolic conditions. Dogs with gastrointestinal problems may struggle to absorb nutrients, leading to gradual weight loss despite eating normally. Other illnesses, such as kidney or liver disease, can also cause weight loss due to decreased appetite or changes in metabolism. If you notice your dog getting thinner, check for other symptoms like reduced appetite, vomiting, diarrhea, or lethargy. A vet can run tests to determine the cause and recommend treatment. Early intervention can help manage the condition and improve your dog's overall health. Dogs hide pain well, but these 11 signs can warn you something is wrong. If your dog shows any of these symptoms, don't wait. Call your vet immediately. Have you ever noticed a warning sign in your dog? Share your experience in the comments. Don't forget to like, subscribe, and turn on notifications for more pet health tips.